Government ministers plus security officials and regional governors strategize to reinforce the implementation of measures to check COVID-19 pandemic in the country. The CEMAC Economic and Financial Reforms Program adopts measures to enable member states caution the economic impact of COVID-19 during its third ordinary session of the pilot committee meeting in Brazzaville. Patients suffering from kidney failure in the littoral region and its environs have been reassured of the availability of hemodialysis kits in the days ahead. The assurance is from the director of the Douala Referral Hospital. And those are top stories. Good evening and thanks for joining us on the 7:30 News with me, Gladys Tata. The Minister of Territorial Administration, top security officials, and some regional governors have fine-tuned strategies on strict implementation of the government and WHO measures to mitigate the spread of the coronavirus in Cameroon. They met today at the Territorial Administration Ministry in Yaoundé in a special working session chaired by Paul Atanganji. Kilanda Ndifon was there. Here's his report.
The Minister of Public Health, Minister of Transport, top security officials, prominent among them, the Secretary of State at the Ministry of Defense in charge of the National Gendarmerie, the governors of the regions already affected, as well as their immediate neighbors, attended the strategy meeting to hold back the spread of the coronavirus.
The measures taken by the government were rendered public by the Prime Minister, head of government, and these measures were approved by the head of state. So we are just doing some kind of brainstorming to see if things are moving smoothly, and if the governors had some preoccupations to tell us, then we will make a report and send back to the Prime Side of government. We'll make a report and send back to the head of state.
The choice of the attendees, like regional governors and some SDOs, was made to achieve self and collective interest through meticulous and disciplined behavior.
We can talk about collective discipline and individual discipline. If things are done properly, if the Minister of Transport says that as from now henceforth, you have to carry, let's say, 20 people in a 40-seater bus, you have to respect the measures. If the Minister of Health says that you have to wash your hands 2 times a day, you have to do this. These are things that we should do. And that if you come and you are in a place of where you are being observed, you have to respect and stay in the place. Those are things that we have to respect.
The regional chief executives, heads or representatives of specialized security services, technical ministries leading the anti-corona spread have left the meeting with firmer determination to resist the killer virus.
Members of the CEMAC Financial and Economic Reform Program Steering Committee is holding its third extraordinary session of the pilot committee in Congo, Brazzaville. At the request of President Denis Sassou Nguesso, the session is chaired by Congolese Minister of State, Minister of the Economy, Industry and Public Portfolio, Gilbert Ondongo. Issues tabled during discussions will include concerted solutions aimed at curbing the COVID-19 pandemic, amongst others. Caroline Okeanoma has the details.
The CEMAC Economic and Financial Reforms Program, the CEMAC, has the mandate to design and implement quick, robust, and coordinated actions both at national and sub-regional levels. This is to ensure stabilization of the macroeconomic framework, especially in a period of health crisis such as COVID-19, which is having devastating consequences on the population and the economies of the CEMAC region.
The ministers in charge of finance, economic and integration in Central Africa decided first to mobilize financial institutions, sub-regional financial institutions. That is the Central Bank and the Development Bank of Central Africa, and also financial markets in order to increase financial support to our states.
Discussions at the third extraordinary session under the chairmanship of His Excellency Gilbert Ondongo centered on the adoption of concerted solutions aimed at curtailing the spread of the coronavirus pandemic, which is creating havoc in the world and claiming lives.
To start technical negotiations with the World Bank, with IMF, with the African Development Bank, so that we can be in a good position to benefit from the new funds created by these institutions to assist all states in the world.
Over 90 billion CFA francs will go to reinforce health equipment in hospitals. BEAC, through the African Development Bank of Central Africa, will inject over 500 billion CFA francs in the monetary and financial systems in all member states. In addition, finance and economic ministers will start negotiations for the cancellation of external debts, amongst others.
The impact of the coronavirus on the domestic economy is expected to be dire if containing the spread remains a challenge experts hold. Be it on imports, exports, or customs revenue, economists hold that measure to cushion the economic stock of the pandemic. Clarice Aritakan tells us more.
Imports and exports, one of the sectors expected to feel the brunt of the coronavirus pandemic in Cameroon. With a 2020 budget of 4,951.7 billion CFA francs to enforce socio-economic development without putting the state in more debt than is already the case, addressing the impact is top on government's agenda. Banking on petroleum exports to keep state coffers adequately furnished, a drop in a barrel of fuel globally, way below what was targeted, has gotten the state looking for a plan B. Even though a relatively diversified economy, oil revenue amounts for a great portion of domestic resources in Cameroon. Though trade with other nations remains on course, albeit painstaking, experts hold with borders still open, meeting local demand is the focus. With reduced exports equally comes customs woes, heightened by production slowing in demand as most nations are looking to increase the manufacturing of essential goods. With non-essential businesses out of supplies and potentially out of business, the fear of bankruptcy leading to job losses remains preoccupying. The domino effect on taxes equally calls for attention, with a number of SMEs worrying they may not be able to uphold their fiscal obligations to the state. Even more so, as infrastructural development objectives may be put on hold as the government grapples with containing the spread of the COVID-19 disease nationwide.
Cameroon will be raising some 220 billion CFA francs on financial markets in order to fund projects in the transport and health sectors. The exercise, to be launched on April 8th, will enable the government continue with infrastructural development while addressing the public health crisis posed by the coronavirus. Clarice Aritakan once more tells us more.
The funds will be invested into projects aimed at driving socio-economic growth.
CAN operations for about 70 billion. Sanitary infrastructure, you have hospitals, and you have even ambulances were also included in the CAN operations. You have access roads into the stadium. We also have in the Ministry of Public Health an envelope of about 45 billion with contributions to the what they call the World Fund for Health.
Banks authorized to carry out the operations will get in touch with potential clients willing to partner with the state in order to attain development objectives. The first exercise for this year will be launched on financial markets on April 8 to raise 220 billion CFA francs. At 37.3%, Cameroon's public debt remains sustainable, Treasury officials hold. No need, therefore, to bother about reimbursement, they reassure.
We have a secured account at the level of the central bank. In this account, we put in a specific amount on a monthly basis. And it is this amount that permits us to be able to do the reimbursement of the interest and the capital at the end of the year.
The public securities will mature in 5, 3, and 2 years at varying interest rates. In 10 years, the state has been able to ensure the execution of major infrastructural works to boost different sectors nationwide. They include transport, water, energy, and agriculture.
Still on the COVID-19 pandemic, most meeting groups in the capital city, Yaoundé, have now resorted to make use of the social media to hold their meetings and mobile money devices to carry out financial transactions. The move is to avoid gatherings which can favor the spread of the virus. PATYCHOU Daisy Fonzenu of our Center Regional Bureau has been finding out how this is done and now reports.
Unlike the past few months where people came together for their meetings, most of them are now scared to sit in groups of more than 10. They now, in most cases, organize conferences online whenever there is need to discuss of issues relating to the meeting.
We have a group WhatsApp in which information has been sent daily.
We have our whole group. In that group, we try to give more information to our participants.
Others, for their part, use mobile money accounts when there is need for any financial transaction.
Also, do a transfer via mobile money or Orange Money.
In cases where the meetings are physical, there are strict measures put in place by members.
We were asked not to be more than 10. We draw a plan so that each day we can have at least 10%.
In our meeting, we have just delegated one person to collect our money, to give it to the person who is benefited.
Worth noting is the fact that all these measures are geared towards limiting large gatherings, which can easily propagate the spread of the COVID-19 virus.
Observing social distancing is one of the 13 measures prescribed by government in a bid to curb the spread of the pandemic in Cameroon. In Yaoundé, for example, this measure is very much observed in swimming pools, with managers declining customers' wish to swim. The pools have been deserted naturally in some places, as Joyce Tata tells us in the following report.
Lifeguards on duty but no soul to protect. Swimming pools like this one at Hotel des Députés have been deserted. The fight against COVID-19 involves everyone. However, hotel management says the pools need to be maintained irrespective of the situation at hand.
The swimming pool is empty. There is nobody because we refuse children who used to come and swim here. When everybody can go in the same water, it may be dangerous.
The few clients hoping to have access to the pool finally end up drinking and then finding their way back home.
At the moment, we just ensure people observe 1 meter distance with each other and probably wash their hands. And we have the lifeguard on duty who is idle because the pool here is for our customers to relax, but they are no longer interested in visiting the pool.
Extrêmement peu fréquenté.
Those addicted to water turn to go on rides at the municipal lake in Yaoundé in consolation, while those who still gather courage to go swimming naturally observe the distancing rule. Medics say such hobbies should be put on hold till the pandemic is contained. As of now, only the fish can feel free in water, while humans remain on a temporary break.
And we now take you to one of the neighborhoods of Yaoundé, where Colette Jani is standing by to tell us how the population are enforcing the measures put in place to contain the spread of the virus. Hello, Colette. So what are you saying?
Hello and welcome to Melen here in Yaoundé. As you all know, for about 2 weeks now, Cameroon has closed its borders. Schools have been shut down and businesses have been advised to shut their doors by 6 p.m. And these are some of the measures that were announced by the Prime Minister head of government last March 17, 2020, in order to curb the spread of the coronavirus in Cameroon. Well, if you know Yaoundé very well, you know Melen is one of those areas where you have a lot of bars, a lot of hotels, and a lot of motels. But as you can see right behind me, you find very few people around me. Most of the bars are closed, most of the motels, all of them are actually closed. And just to mention that here in Melen, in Yaoundé, just like in other parts of the central region, administrative, municipal, as well as security officials are working very hard to make sure that these measures that were prescribed by the head of state are being respected. For example, in Minifam this evening, we actually met some members of the Gendarmerie Corps actually going about closing bars and restaurants that people were actually still sitting in and eating after 6 p.m. This is just to tell you that even though some people have understood some of these measures, others are taking it for granted, but security officials are there to ensure that these measures are being respected. Now also mention that in the central region, events like football tournaments, political rallies, workshops, seminars have all been temporarily suspended. And of course, business persons have been advised against profiteering by increasing prices of goods in the markets. Kolejani, CRTV, Melaine.
Thank you very much, Kolejani. We shall be coming back to you in a subsequent newscast if there are any updates. And some officials of the West Regional Delegation for Transport are on the field to ensure that owners of transport agencies all over the region respect the measures put in place by government to check the spread of the coronavirus. While on the field, they verify the number of passengers in buses, as Kelvin Nembo tells us in the following report from Bafusam.
The team headed by the regional delegate for Poponyinyi Mfendaun Musa visited almost all interurban transport agencies in Bafusam town to verify if adequate measures taken by the government to curb the spread of COVID-19 were being respected. For example, that not more than 50 passengers are transported in a 70-seater bus, no overloading, and that the 1 meter safety distance is also observed. Prescriptions were respected in most of the agencies. They also noticed with satisfaction that owners of most transport agencies fully joined the fight. Proof: vehicles were systematically sprayed with disinfectants before takeoffs, hand sanitizers put at the disposal of all, the washing of hands with soap effective, the putting on of gloves and masks by all personnel now mandatory. The team also exchanged with the passengers on the importance of basic hygiene, presently the #1 cure for COVID-19. In other agencies, posters were pasted in strategic areas to sensitize passengers on the need to join this collective fight if we must win the war against this public health crisis.
Let's now hook up with Gilbert Ongene, who is on standby at the Public Health Emergency Operations Center here in Yaoundé with the latest updates of COVID-19 in the country. Good evening, Gilbert. Now tell us, are there any new cases of coronavirus over there?
Hello, Gladys. Welcome to the Public Health Emergency Center. The news here is that there are 2 additional cases of death from the coronavirus registered today in Douala. This brings the total number of deaths in Cameroon from the COVID-19 to 6. That is 4 in Douala and 2 in Yaoundé. The other news is that there is a new case confirmed in Limbe, Southwest region. This brings to 4 the number of regions affected by the pandemic in Cameroon. Our guest tonight is Dr. Eric Tanzi. Hello, welcome to the CRTV.
Yeah, Gilbert, good evening. Thank you.
Now tell us, how did you get news of the case in Limbe?
Yeah, thank you, Gilbert. It should be very clear to reiterate here that all cases that have been confirmed has the same method of analysis where we collect samples wherever there is a suspected case and do an analysis, a laboratory analysis, before the cases are confirmed. So that is how we come to confirm the case in Limbe. Thank you.
Okay, tell us, the minister in a tweet this morning talked about irresponsible persons who come from epidemic or risk countries and who, instead of signaling their situation to the health authorities by calling the number 1510, hide at home. What is your take on this?
Yeah, thank you very much. I think the public health boss was simply reiterating or creating awareness and concern for those who have come from abroad that have not bothered to call the 1510 toll-free number, to rather do so that we should be able to identify and do a sample collection to know if their situation is negative or positive. This is a measure in which we are doing, or he is applying, so that we could curb the spread of this pandemic in our communities.
Now, after that tweet, have you noticed a change in attitude in terms of such people who were formerly carrying out feet dragging in terms of reporting cases to the authorities or to your center?
Thank you very good. Thank you very much. I think that is a very good question and pertinent. I should tell you that in this Public Health Emergency Center, within the last 24 hours, we've received 2,218 calls from the population, which means that the population are actually getting aware and more concerned about this, what the minister tweeted. So I think the information here was that the population should be responsible, they should be disciplined and keep on calling so that we could come to their rescue.
Okay, now we are at the Public Health Emergency Center. Can you tell us how work is organized here? We can understand the kind of pressure that's on your soldiers here.
Yeah, thank you very much. It is a well-organized center, you know, under the supreme control of the Minister of Public Health. We have incident managers and other sections and units. Okay. So, you know, we have communication, laboratory analysis, and even the watch department. All this is well planned and it is extended within the region. Let me just tell you perhaps briefly that in few hours ago, the minister had a meeting with the Minister of Territorial Administration and regional governors because he planned to decentralize the management of this activity so that we could have more proactive and confidential information to the population at all times.
Thank you very much indeed, Dr. Tanji Eric. Well, Gladys Tata, that was the situation here at the Public Health Emergency Center. Over to you, studio.
Very much, Gilbert Onkene. And as we said earlier on, we shall be giving minute-by-minute reports on how it unfolds there at the center. And over in the littoral region, the Douala market, fondly called Marché Congo, has remained closed as sanitary agents from the Douala 2 Municipal Council disinfect its environs, while peripheral roads are cleared of makeshift shades that strain circulation. On his first outing, the Douala City Mayor Roger Mbasindine, accompanied by the mayor of the Douala 2 Council, have been inspecting sites wherein some observations were made on how to improve free circulation and sanitation around the market. Dixon Ashu has more from Douala.
A call were yielded by traders of Douala's largest market prior to plans by the Douala 2 Municipal Council, communicated earlier, to disinfect the market environs as a way to counter the deadly coronavirus spread. The action is one of the measures arrived at during the March 21 consultation of Douala mayors to bring environmental and health sanity to the city of Douala. On a maiden outing since installation, Douala's pioneer city mayor, Roger Mbasindine, accompanied by Denise Fampo of Douala 2, went around the business avenue for a forehand of the disinfection activity so far. They also observed alongside market management staff and quarter heads that there was need for a freer circulation in and around the market, as makeshift business sheets and other obstacles along corridors and peripheral roads are marked for demolition or are demolished on the spot.
We are confident that this measure will help to strengthen the fight against the coronavirus.
The lighting system of the market, they observed, is also to be reviewed, main entrances to be freed, and this path that leads to the Commando neighborhood, amassed with rubbish over years, is to be cleared and served as a secondary road. The market resumes activities 24 hours later, as other measures are in view to not only stop the coronavirus spread, but also bring sanity to this business arena.
And in Adamawa, officials of the Regional Delegation of Livestock, Fisheries and Animal Industries have launched a one-day sensitization campaign to encourage meat sellers and other vendors to apply the measures put in place by government to fight the COVID-19 pandemic. The team was led by the Regional Delegate for Livestock in the Adamawa, Musa Yaya, who reminded the population that implementing the hygienic rules as required will reduce the spread of the coronavirus. Sadu Yauba reports from CRTV Adamawa.
Raising awareness on sanitary conditions amongst the population to combat the COVID-19 pandemic appears as a priority. Campaigning to save lives, officials of the Regional Delegation of Livestock, Fisheries and Animal Industries for the Adamawa attempted to remind people the dangers and preventive measures of the novel coronavirus outbreak.
Especially all the actors that deal with livestock, such as butchers, people that roast meat and fish. They should frequently wash their hands, they should wear gloves and masks, and they should have a distance between them and the customers.
They add implementing environmental sanitation and other proactive measures in connection with the government recommendations is required to ensure a healthy living environment. For now, measures adopted by the locals are appreciated.
We find some people have already started, and that was a really good measure, such as washing hands with soap and clean water, but we still try to emphasize on it.
Maintaining good hygiene practices around food like meat could reduce the risk of contamination.
In the southwest region, the mayor of Limbe, Andrew Mutanga Munjimbo, has sensitized the population on the dangers of not respecting measures put in place to stem the spread of the coronavirus. He was speaking while launching a week-long campaign to educate the public on best practices to adopt. Details with Henry McCauley.
Limbe is one of Cameroon's major business locations. With its port, the refinery and major enterprises, it is difficult to prevent people from getting into the city of Limbe or to move within the city. Furthermore, most of the people of Limbe depend on small businesses for survival. It is difficult to hold them down. With the advent of the coronavirus, experts like the director of the Limbe Regional Hospital, Professor Kinget Thompson, have observed that if the city cannot be completely locked down, then the behaviors and attitudes of the people of the city of Limbe can at least be adjusted in such a way that it can minimize or limit the spread of the virus. So the mayor of the city of Limbe, Andrew Mutanga Munjimba, and the district medical officer, Dr. Constance, were in the different markets, bus stations and major joints of the city to get the population to understand that there is no cure for the disease as of now, and that the only option is to respect measures put in place by WHO and the government.
This message should be the message to reassure our population. I just want to let the population know that they should not panic, but they should be more serious.
Everybody has to come on board for the fight against coronavirus in our communities, to emphasize on the preventive measures, because that's all we have for now.
The crowd that came out to listen to the campaign expressed their satisfaction with the exercise, adding that they will not hesitate to adhere to the WHO and government measures.
One of Africa's leading female scientists has called on Cameroonians to respect government's rules to combat the coronavirus. Cameroonian-born Professor Rose Leke, a heroine of the World Health Council, has granted an exclusive interview to CRTV. She spoke to Charles Ebune.
People are making their own masks now. I've seen, when you look, and I don't do much of social media, but you see even leaves are being used. People are using clothes and using different things. And it depends on where you're producing those masks also. You might produce them in areas where you might have more trouble, more bacteria if you look at some of these production sites. But the masks at least are helping. The other measures that have been they've asked us. We have in our country, those 13 measures that the Prime Minister put. Everywhere you have mitigation measures. And if people would adhere to those measures that we have here, the social distancing, we're sitting here at this, we sit far from each other, the social distancing that has been talked about, but you go to the markets and you see what is happening in the markets. Coughing and sneezing, that you should do it, in your elbow if you're doing that. And most of all, washing the hands. Now you find all those wash hands and so on into government ministries, which is good. But go to our markets and see what is happening there. That really, it scares you. And we've been looking, even the bars that the city should close, it's closed and there are people inside. So there is some kind of sensitization, I think, that hasn't yet arrived to the people.
And the general statistics of the coronavirus worldwide show this evening that global infected cases of the pandemic stands at 702,568, while 33,190 persons have died of the virus. In Africa, South Africa now counts 1,187 cases of infected persons. Cynthia Etim now presents the situation recorded by 6 p.m. this Sunday.
Going by facts, as at 6 p.m. this Sunday, March 29, the general statistics of the COVID-19 pandemic worldwide stand at 702,568. Number of deaths, 33,190, and 149,219 people have recovered. In the rest of the world, USA tops the chart with 131,403 infected cases, 2,329 deaths, while Italy, which records 97,689 infected cases, tops the chart of the death with 10,779 deaths. 13,030 persons have recovered. Spain's death number stands at 6,606. China records 3,300 coronavirus deaths and 81,439 infected persons. France today has a total of 37,575 infected cases and 2,314 deaths. Germany and Iran are on the chart, with Iran recording 2,640 deaths. As on how the situation is on the African continent, when we were writing this report, South Africa leads with 1,187 infected cases, while Egypt tops the chart with 36 deaths. In Algeria, 31 persons have died of the pandemic. Morocco records 450 infected persons, and Burkina Faso has 207. 26 persons have died of the coronavirus in Morocco and 11 in Burkina Faso.
And on our leader stories, the Director General of the Yaoundé Referral Hospital, Dr. Luma Henry, has reassured dialysis patients undergoing treatment at the hospital that regular dialysis will resume in a few days' time. The reduction in the number of sessions, he went on, is due to a break in the supply chain of dialysis kits. Veronica Benyela tells us more from CRTV Littoral.
It's been barely 24 hours since the dialysis department of the Douala Referral Hospital started applying reduced dialysis services.
As of yesterday, we ran short of dialysis kits. In reality, we would say that it is a temporal situation, because we are sure that in the next few days we'll have these kits.
According to Dr. Luma, the present situation is a consequence of the outbreak of the coronavirus that has caused a break in the delivery chain.
There is a current epidemic of coronavirus, and kits which were supposed to have been here within the last 2 weeks, coming from Morocco, Royal Air Maroc cargo planes have not been able to land here in Douala.
Meantime, a shipment of dialysis kits that arrived Cameroon by sea is being removed from the Douala seaport.
Having contacted the Director General of Customs, these goods will be released so that by Monday the service will go functioning normally.
To ensure continuous service, Professor Halle Marie Patrice, head of the nephrology department, has designed a treatment plan to keep patients going.
One dialysis session per patient instead of 2, but will allow patients who have their personal kit to come and dialyze for free in the center. For emergency cases, I mean patients who are newcomer or those who cannot sustain one dialysis per week, will have kits.
Patients we met at the hospital testify that they all got their first treatment of the week, but the second one is for those with equipment.
National Gendarmerie Road Safety Task Force is enforcing government prescription to stem the spread of coronavirus along the major road access across the country, in addition to the mandatory role of tracking and punishing delinquent road users. Kilian Dandifon was with the team that controls the Yaoundé-Mbalmayo National Road No. 2 this weekend and reports that the control is systematic and strict. Kilian?
At the first, like at the second control post, before and after Mbalmayo,
the rigor of control by the road safety team.
Respect of the prescribed number of people in transport vehicles, respect of social distancing amongst others. And since we are here, road users are respecting these measures.
Coronavirus must neither spread through negligence, ignorance, nor disrespect of prescribed prevention rules. Coronavirus does not even respect security officials, so extra measures to protect them have been taken.
For our own safety, our hierarchy has provided protection materials such as hand gloves, face masks, etc., because we are exposed to the virus.
The National Gendarmerie has, in addition to its mandatory road safety campaign, taken the leading position against the spread of coronavirus on Cameroonian highways.
And that is the package we put together for you on this edition of the 7:30 News. Thanks for watching. At 8:30, you'll be in the company of Atabadine Omar. From tomorrow, you will be with Ben Meno Pufong, and on Friday, take the rendezvous. Until then, it's bye from all of us on the 7:30 crew. Good night.
CRTV News, ici, toute l'info.